The value of innovation calls for displaying creative and original thinking, embracing and supporting new initiatives, and driving results through sustained focus and energy. That's exactly what Epic analyst James Preston does every day. He demonstrates that getting to yes and innovation go hand in hand. That's why he's this year's recipient of the Bellin Values in Practice Individual Award winner for innovation. Just because something doesn't exist doesn't mean it can't be done. That's the approach James Preston takes to the challenges he faces as an IT analyst. Need an easy-to-use tool to evaluate risk factors for surgical patients? Need another tool that's specific to the cath lab? He can do that.
Innovation for me means somebody who is very creative and who can think out of the box, and basically to be able to come up with something that hasn't been before.
The first thing that really impressed me was when we were building a system to support the cath lab for their documentation. The present documentation wasn't working all that well for them, and he found that within another module that there's enough bits and pieces to put together what's called the Cupid module, which supports the cath lab.
For us, it was fairly innovative because we, in a lot of ways, invented it from scratch. I vaguely knew that there was a cath lab module in Epic and started playing with the tools and demoed it to our cath lab staff to get their buy-in. By the time Epic got there, we just basically plugged it in and used it.
We were given a big challenge by our administration and our team to come up with a tool for our perioperative surgical home. It's a very different way of thinking about taking care of patients. It's very focused on getting them through their surgery journey, and we searched through our Epic, and we kept hitting roadblocks. And so he created a tool that has never been done before.
One of the things this team was looking for was a way to help, we'll say, mine the patient chart for relevant risk factor information and pull it together into one at-a-glance report to see how healthy this patient might be for surgery before they get anesthetized. The challenge with pulling that information together was, to get it in one screen that you don't have to scroll through, that you don't have to click 5 layers down to see what you're looking for. Something that is looking for all the rich information that's in there from primary care, from the surgeon's office, and pulling it together into one screen that you can look at in one glance.
He has a way to keep the team energized, and sometimes if we get stuck on something, he'll have those what about questions and keep the ball rolling.
I like to think that as far as healthcare and IT are concerned, there's a big promise from IT to healthcare of everything that you assume IT can do to improve healthcare. And it's time we start living up to that in every way. We need to make sure that our computer systems that we use in the hospital live up to the expectations of everyone who uses it. I'd like to thank the whole Prepare team, from Dawn and Jolene, Cindy and Selly, Dr. Asaf, Dr. Marshall, Peggy and Kent for the nomination. It's a great feeling to get this feedback, to know that the work I do is appreciated.
Congratulations, James. I'm really excited about you winning this VIP. Couldn't be deserved by anyone else. Way to go.